Hi, my name is Brandy. I am a current nursing student at Casper College, and in this video, I am going to discuss blood pressure and how to check your blood pressure at home. What is blood pressure? To make it simple, blood pressure is when your heart pumps blood, beats in the body. The blood pushes against the artery walls, which creates the pressure. It is the measurement of the pressure and force of blood against your arteries. Your blood pressure is represented by two numbers called the systolic and the diastolic. Systolic is the top number. It represents when the heart contracts. The heart squeezes and pushes blood into the arteries. The diastolic is the bottom number. It represents when the heart is relaxing. This is the lowest pressure in your arteries while your heart is resting between beats. Your blood pressure changes to meet your body's needs. Blood pressure is ranged between low blood pressure, hypotensive, normal blood pressure, and high blood pressure, hypertensive. Blood pressure is measured differently by ages, but in this video I'm going to focus on adult ranges. Hypotension is when blood pressure is less than 90/60. Normal blood pressure is 120/80 and below. And hypertension is now based off stages. High blood pressure stage 1 is when blood pressure is 130/139/80/89. High blood pressure stage 2 is when blood pressure is 140 or greater over 90 and greater. And critical blood pressure is 180 and higher over 120 and higher. Now I'm going to tell you the proper way to take your blood pressure at home. Home blood pressure is an important thing you can do at home to help protect your health. Inadequate blood pressure readings can lead to misleading problems. Try to find a quiet and peaceful place to take your blood pressure. Make sure you are sitting in a chair where your feet are flat on the floor and your back is supported. Make sure to use a proper upper arm blood pressure cuff for your size. You want to make sure your arm is bare, avoiding any clothing. You can see on the blood pressure cuff there are directions on where and how to align on your blood pressure arm. You also want to make sure your arm is resting on something, like a chair arm or a table, and your elbow is about the height of your heart. Most monitors have a start and stop button. Sit for a few minutes before you start. Once you're ready to start, hit the start button. It is best not to move or speak during the time the monitor is running. When the monitor is done, you can move and check the numbers recorded. For the most accurate reading, try taking it at the same time every day. Hypertension almost affects one half of the U.S. adult population, 18 years or older. According to the CDC, between August 2021 and August 2023, 122.4 million U.S. adults, 47%, are estimated to have hypertension. Hypertension is higher in men than women. Hypertension is seen to increase with all ages. Being aware of having hypertension can have a huge impact on your life. 59.2% of adults were only aware of their hypertension. Hypertension can cause a wide variety of symptoms and long-term effects. High blood pressure affects the body's arteries by the force of the blood pushing against the artery walls. Being constantly too high can cause damage. Untreated high blood pressure increases the risk of heart attack, stroke, and other health problems like heart disease. Signs and symptoms of high blood pressure may be headache, shortness of breath, nosebleeds, chest pain, fatigue and confusion, dizziness, pulsation in the neck or head, and/or changes in vision. There are many symptoms of high blood pressure that everyone may experience differently. Long-term effects of hypertension can be damaging to the heart and other organs since they rely on blood transmission by the heart. High blood pressure can damage other vital organs as well. For example, blood pressure in the eyes can get strained or damaged. Protecting yourself from high blood pressure can help in the long run. Knowing your blood pressure and what the numbers mean and indicate can help you seek medical treatment early. You can reduce and manage your blood pressure by making healthy style changes, having a well-balanced diet, getting the adequate amount of exercise for your age range, avoid smoking and alcohol intake, getting the requirement amount of sleep and staying hydrated, and reducing or managing stress can all help high blood pressure. Thank you for taking the time to listen to my video and the understanding of blood pressure, learning how to take your blood pressure, and a brief understanding of hypertension. I hope you enjoyed this video and learned something from it.